In this video I will be discussing the condition dry macular degeneration and would suggest you review my previous video on what is macular degeneration and how does it develop prior to viewing this video. Dry macular degeneration is the most common form of wear and tear change in the retina and tends to be the less severe form of macular degeneration, although in some patients it can produce significant loss of central vision. It is due to a gradual wear and tear process within the retina. The rods and cones of the macula, whose function is to convert light into electricity, work flat out from the moment we wake up in the morning till the moment we close our eyes at night. And as a result of working at such a high rate, they have to be efficient in what they do, and one of the ways they are efficient is to recycle material. And the function of the retinal pigment epithelium, which lies directly below the rods and cones, is to recycle material and assist in the rods and cones working to convert the light into electricity. And one of the main features of dry macular degeneration is that with the passage of time, this recycling process becomes less efficient, and as a result, waste products of metabolism accumulate within the retina. These can be seen clinically or on photographs taken of the back of the eye under yellow spots which are called drusen and are a sign of dry macular degeneration. The other sign of dry macular degeneration is change within the retinal pigment epithelium. It contains a pigment, melanin, similar to the pigment in the skin, and the function of the melanin is to stop internal reflections of light within the eye to help with the optics of the eye. And with dry macular degeneration, you can either get an increase in the amount of pigment with pigment clumping, or the pigment can disappear and the retinal pigment epithelium can disappear and you get a white patch because you're looking straight through to the bare sclera, the white of the eye, underneath the retina. So the three signs when we look at the back of the eye of dry macular degeneration are drusen, increased pigment and reduced pigment. What are the symptoms of dry macular degeneration? Well, they usually come on very gradually, and it's usually a gradual blurring of vision, occasionally distortion of vision due to the lumps associated with drusen formation, and in more severe cases you can get more significant loss of central vision and very patchy vision with words jumping into and out of areas of poor vision. And in these more severe cases there is a specific type of dry macular degeneration called geographic atrophy, where you have areas, patches of the retina that are functioning very poorly due to loss of tissue. Unfortunately, there is no good medical treatment at present for dry macular degeneration, so the main treatment remains optical to ensure that the vision is as good as possible by using magnifying devices and good lighting. It's also important to, if you have got significant loss of central vision, ensure the social services are aware of your vision impairment to help with financial benefits and things around the house, and so it's important to be placed on either the partially sighted register or the severe sight impaired register. And in terms of the way things are going in terms of research, there are certainly some very interesting research in this area, with stem cell research being a potential very useful area of research for future treatments of dry macular degeneration.